We are going to talk a lot about artificial intelligence.
The first signs of AI were back in the 50s. To me, the first version of AI was war games. If you remember the movie from the 80s where shall we play a game, right? That was the concept of a machine that could talk and correspond back and forth with basically built-in intelligence. So the biggest demand we're seeing is people looking for ways to automate the manual processes. That's really been the jump-in point for folks to say, if I'm going to embrace AI, it's more than a Google search.
AI can make decisions, but maybe not the right decisions. And I think that's the concern that a lot of people have, is because it's garbage in, garbage out. So AI is refining a historical perspective. It cannot use critical thinking capabilities. Well, hello everyone. Welcome to another episode of the Leadership Lab with Asbel Montes, and I am ecstatic to be here again with my business partner, Brian Choate. And we are going to talk a lot about artificial intelligence. We already did an episode about this.
Yeah.
We're going to expand upon this a little bit and talk through a few things as how we're using that in our company and in our business as well. So to the audience, I know everybody, it's kind of the normal buzzwords that we're hearing right now. Artificial intelligence, everybody's talking about it. It's almost ad nauseum. And so how do you sort through that? How do you look at that? And we're going to actually talk about it specifically from the healthcare finance. We might drop in a few anecdotes about some other things, but we're going to try to keep it pretty much to healthcare finance, how revenue cycle leaders, financial leaders, especially in the healthcare industry, can use this in their process, how we're doing it also internally as well. So welcome, Brian.
Thank you. I appreciate the opportunity to be here and do this again with you.
Absolutely. It's always fun. So, Brian, let's talk about in our environment today, in our AI environment today, let's talk about the history of AI, because some people think it just started. But give us some history about how AI actually started and some things around that.
Sure. It's interesting. The first signs of AI were back in the 50s. I think it's 1951 was the first. It was an AI program that essentially was a chess game. It would play checkers, and it would something that people couldn't beat with intelligence. And then they went on and created actually a chat model. There was I think it was 1960s. I think it was. They created basically a software program that would have communication back and forth. To me, the first version of AI was war games. If you remember the movie from the 80s where shall we play a game, right? That was the concept of a machine that could talk and correspond back and forth with basically built-in intelligence. So it's not new. Right? It's been around for 75, 80 years now. People have been playing with a version of AI, but until we had more processing power. That was a real challenge. What would actually make AI something that's usable, not in a warehouse full of servers, but actually to a small machine learning to be able to do more with it. So,
yeah, and I think that to that point, I think the reason why it's gotten so much buzz is because it's now what we call open, and it's open source, so anybody can use it now. It wasn't just commandeered to a company, right, or to one or two or different competitors that were using it at the point in time. Now it's just open to anyone that wants to create anything. It's now available to you.
Yeah.
And that, I think, is the reason why everybody's talking about it now. It's almost like when the internet came years and years ago, people were afraid, I'm not using the internet. Why should we use the internet for? Because it's going to take away people's job. Like the same construct, if you look back 30, 35 years ago when the Internet Explorer is a lot. I was in California a few weeks ago at a conference speaking about this exact issue, kind of brought up the Internet Explorer type concept and some of the same gloom and doom that was going on. And I asked a question of the audience, like, how many had their library cards? Remember having a library card when you were young? And I would go to the library and I would do all my research at the library, pull in books at the library. But now, how many still have a library card? I don't have a library card. Now, there was a few people in the audience that raised their hand that still have a library, but it's the exception now that generally will go to a library. Most of them are becoming museums. Some people still go to the library, but I call it like a fad right now. It's similar, Brian, to, like, I remember when the e-readers came out and the book industry was all up in arms. Like, who's going to buy paperbacks anymore and hardback books or whatever? Because
going to
people
lose
had
jobs. Yeah, exactly.
Kindles and whatever, because I had a Kindle, but I realized pretty quickly, you know what? it doesn't have that same feel for me as reading a hard. So I literally, that's all I have now. And I used to have a Kindle. I used to have an iPad that I looked in and read, but I just didn't get that same feeling of underlining or what have you. So I think that we need to keep our mind open about AI and the good parts of AI. What is that and how is that from that perspective? So when we look at it and how it's evolving, so let's talk a little bit about that, because we technically have been already using machine learning at our company. We are a technology company, for those that do not know. Solutions Group is a healthcare finance technology company. We do a lot of stuff around deductible management. We do a lot of stuff around insurance discovery, verification. We have service lines, but very, very niche in the healthcare finance space. That's why we're keeping about AI in the finance space. But let's just talk a little bit about, Brian, how we've been using machine learning, AI, things like that, even within our own company, and how that's helping provider communities and healthcare provider communities as well.
Sure. I think a lot of it, financial pressures are what have now forced the healthcare finance leaders to really start to embrace some type of AI, short staffing, right? The pressure to push down cost, the pressure to get more efficiency out of billing offices and whatnot. From our perspective, the biggest demand we're seeing is people looking for ways to automate the manual processes, right? And that's really been the jump-in point for folks to say, if I'm going to embrace AI, it's more than a Google search, right? If you're over 40 years old, most of us use a Google search. Like, well, if we go to ChatGPT and we're going to give it a Google search, and it's like, no, it's actually going to do advanced research. And so if you bring that over to healthcare finance world, our clients, we have conversations on how can we remove some of these manual friction points that take people and hours, and it's not the best use of folks' time. And, pre-bill automation, right? Using our solutions, we've got 65% of the pre-bill manual touches can be fully automated and directly move claims into the billing side and get them out of that pre-bill, that manual grind of trying to find information, trying to verify insurance, identify a payer, clean up demographics. All those things can be automated in a way.
Correct. So let's just kind of work off of that just a little bit. We've actually introduced 2 new products into our line. One's called IntelliScrub. It's a patent pending product, as well as we have another product called IntelliAR, which it's more around machine learning, bot technology as well, that's been around for a while, but it really is helping healthcare finance groups augment, make things easier. Yeah. How do we use things? So let's talk around the IntelliScrub concept, because that does use a mix of artificial intelligence with machine learning concepts and constructs to make healthcare providers much more efficient when it comes to cost containment, increasing revenue, things like that in their own current healthcare finance processes.
Yeah. With the pre-bill process being one of the most manually intensive parts of it, where we've got trained people that literally do the same process over and over and over again, right? The time it takes to process a new claim coming in, and whether it's coming in from an EHR or EPCR and then into the billing system, they're trying to identify, do I have the right address information for the patient? Do I have the right spelling of the name, the date of birth? Do they have insurance, right? Maybe they've seen the patient before and there's old insurance that's outdated, no longer active. And so the manual touches involved of doing discovery and going to multiple websites, looking things up, typing the name and the date of birth, hoping you type it correctly and don't have a typo. And, all those are connection points where AI can go through, machine learning can go through and say, look, I can clean up the demographic. I can go to the credit bureau for you, come back and correct the date of birth, give you the right address, give you the apartment number you're looking for. Why would we want a biller, a pre-biller in our finance offices manually working through those data points, those websites, when you could put it into an automated process? Find it, clean up the information, do the discovery work for you. No one's having to stop and make those decisions for the simple things. AI is not great at making decisions, and that's where really we want to keep our pre-billers, want to keep our focus in those offices, is let our...
Well, I think AI can make decisions, but maybe not the right decisions. And I think that's the concern that a lot of people have, is because it's garbage in, garbage out.
That's right.
So AI is refining a historical perspective.
Yeah.
It cannot use critical thinking capabilities. Now, there's people that are going to probably start arguing about this right now because you've got the generative AI process. But ultimately, in order for AI to understand or critically think, it has to process information. How does it get that information? It's whatever you put into it. Right. And so that is what we're trying to say with our product that we're talking about right now is how are they coming through that? How are they looking at that? So it's not going to get it to 100%.
Right.
And we talk about that a lot with our IntelliScrub process is it, generally if it can remove out 60 to 70% of what you've got humans doing, your humans can focus on those things and it can target them very specifically on those items that need a human brain for the critical thinking capabilities, which creates efficiency. And so that to me is the dynamic that happens with this IntelliScrub concept. What are some of the other things that IntelliScrub is bringing to that? I mean, think about it from the third-party liability. There's things that it can uncover that maybe current processes aren't currently doing it. We're having a fun time discovering all of the things that it can do for some of our clients as we're really ramping this. Is probably our fastest moving product right now.
Sure. When you write software code, you write rules, and algorithms to look for a set of circumstances when an account comes in. In the human world, we have what we call billing creep or process creep, right? Where we have a way, we have a structure we're supposed to follow, but we're not robots, we're not perfect, and we're going to vary on those tasks a little bit. And when you've got algorithms and machine learning built in, it's going to do it that way every single time. And so something as simple as, a billing record comes in, you would look and say, okay, this patient has Medicare, or they have Medicaid, that's who I'm going to bill. But yet sometimes a biller can miss the fact maybe it was from the scene of an accident. And rather than billing Medicare, why wouldn't you instead do a discovery for liability carriers, find out is there a auto policy or workers' compensation policy. And so rather than billing Medicare $104 or whatever the rate's going to be, full charges, right? We'll get picked up by liability carriers. There's no deductibles to contend with. There's no co-pays to try to collect. And so our billers, again, start thinking in a widget mindset sometimes, and we're just going to take the lowest common denominator, what payer I've got, add it, bill it. And there's a big differential between a liability payment and getting paid by Medicaid on something.
Well, especially right now when healthcare providers aren't seeing any increase in funding. Yeah. And so it's like, how can we operate more efficiently? Are there things that we could actually do? I know there was one client that we were talking to earlier, probably last week together, and we asked them to run some numbers relative to tell us how many, and this was an ambulance service at the time. It wasn't, of course, this works for any healthcare provider type. It doesn't matter, but I'm going to focus just on an ambulance service that we were talking to. And they, I think, had almost 100 responses to motor vehicle accidents, but only 6 of them captured motor vehicle information, which tells me, generally speaking, when our product runs on stuff with using some machine learning, some AI integration through the process, we generally find 43% on average.
That's right.
And so that tells me right away there's something off in their process that possibly could be augmented by an enhanced machine learning AI type engine like IntelliScrub and MVA process as well.
And the financial impact, again, if there's no more money coming and there's downward pressure on, you've got to cut costs, you've got to find ways of reducing your cost or recouping more money. If 100 claims you bill Medicaid, Medicare, and instead you could take 20 of those, 40 of those, and identify the liability carrier. But again, our billing offices, especially in the pre-bill side, they're thinking, I have got this many tasks that I have to complete per hour. They've got KPIs and metrics. And so it's just human nature to take that path of least resistance, grab the Medicaid payer, bill it out, and move on to the next claim. And this is where you can use machine learning to say, hey, hang on, there might be a better payment source available before you build that out.
Yeah, and I think that gets down to what you're talking about, because we all talk about key performance indicators and what are those marks, because we're all competitive in nature. And so that's the number one thing I always get, like, okay, Asbel, what's the key performance? How do I match up against that? Because it's like, well, I want to be number one, or, oh, am I number 150 out of number one? So what could I do better? And so then we focus so much on the KPI that we kind of condition and train sometimes our finance teams to do things that aren't helping actually recover more revenue. Yeah. And these are the things where you have to keep everything within context. How can we do better? What can we look at versus is there some, I always like to use technology to say, if I think my processes are as good as they are, we all like to think that we have the best process. How do I know? Unless I compare it against something else or benchmark it against something else. So oftentimes when I'm talking to providers, it's like, use technology. It's going to help you. It's going to understand, am I better or is there some processes that I can improve upon? And that's what IntelliScrub does. IntelliScrub allows you to take a look, but it also allows a component that's different than most solutions out there because it allows customization.
Right. That's right.
Whereas we all like to customize, we like our billing systems to customize things, but unfortunately they can't be everything to everyone. And so this allows for some customization that might be very unique to you. As a healthcare provider in an area, you might be an urgent care center that says, you know what, in this area, I'm picking on Georgia, this area of Georgia, there's 2 different health plans and they operate totally different and they're nothing like any others that operate in the United States. Well, you can actually create customized solutions through IntelliScrub to provide that. So talk a little bit about what that does, because that has been the thing that's probably resonated the most with our clients, because we have a waiting list right now. Onboarding this type of thing, but it's around that customization piece.
A scenario, if a provider has a facility contract, let's say like the world of EMS, they're picking up a patient or dropping off a patient at a specific facility address. In situations where that facility should be billed for that transport, and then we end up, a provider can bill the patient instead accidentally. Let's say there's not insurance information on it. So now a patient's receiving a bill when that should have gone to the facility. Well, writing a custom rule using IntelliScrub, the system would identify, that address is a location that we should not be moving that off to self-pay. That's a facility bill. And so rather than pre-billers having to stop and look at that and make that determination using the machine learning side, it could push that claim to a workflow now to be billed directly to the facility instead. And that process creep just happens. It's human nature. And so the way you write the code, it's constantly looking for you. It's your bumper system. You're trying to move the exceptions. That's what you want your pre-billers to look at. But the rest of it, that 60, 70%, can really move its way directly into the coding, and out the door the claim goes.
And that's what's exciting about it, is in the technology side. I mean, my background, I've ran very, very small healthcare finance offices to very, very, very large healthcare finance offices. And now us owning a technology company, as well as even providing this service trend as well, has just been eye-opening and continuing to see the efficiencies that we can continue to bring to the industry. So I'm going to flip subjects here. Let's just kind of flip the topic and move back to more of an overarching artificial intelligence component and the use of this. And I'm going to go back to some of the things, and this is a webinar that we'll probably do, but I talked about 5 things to consider with artificial intelligence at a conference that I was speaking at to on the West Coast. And one of them we talked about was AI should augment, not replace. Yeah. So let's talk about that in the healthcare finance space. Let's talk about that outside of, because there's a lot of concern around protected health information, PHI. I'm going to be doing a podcast here shortly that will release as well, that we're doing with our general counsel, that we've actually assigned to do a lot of things, that we've been doing a lot of investigative work into this for the last 7-8 months on how we can practically evolve in the AI world. I'm a crawl, walk, run guy. Yeah. Always have been. Slow and steady wins the race. And so I'm not one to just join the masses. Most people that know me know I'm an original. I refuse to follow, and I'm going to follow this and work this thing through what I feel is the best. But there are some things that there is no downside. There are some AI tools that we should be utilizing in healthcare finance, Brian, that has no downside. And we've actually had some of our employees, 2 of our data engineers that have actually been doing a lot of investigative work into this, and they'll be presenting to our team on what we've considered to be the top 10 that we really want to start to introduce. So let's talk a little bit about that on AI. Maybe this can help some people that are listening to this podcast relative to, I like AI, but it makes me a little bit nervous. People are afraid that it's going to replace, but there are some things that you can do that we have just been experiencing for the last 7-8 months. It's amazing some of the things that it talked about. But talk about one or two things that you've been using, you've been working through. I'll give some examples. We'll kind of walk through how it can augment some people in their current business operations and what they're doing.
You know, I think for me personally, one of the first uses was doing a tool called Fathom. Fathom is a AI note taker, and on steroids though, right? Because after a call, every attendee on the call gets a follow-up email. There is a link. There's a synopsis of the discussion, what was said, and then a link you can click into and actually replay that part of the conversation. And having access to tools like that, you know, look, even with an organization our size, there's 10, 12, 14 meetings a day, calls going on with clients, internal, external calls, and the ability to, as a leader to look in and get that synopsis without having to actually attend each one of those calls. It allows us to make more strategic decisions. Now we're able to stay at a higher level and really just kind of understand without getting in all the minutia from day to day. And that's been an efficiency booster personally for me. It's a game changer, right?
Well, I know sometimes what we do is we just say, put people on CC.
Yeah.
They don't need to be on there. So I need to be on that call. So we make them optional. That way you get the notes.
Yeah.
And other people that might be listening, might be whatever. There's a few out there. Research them. Fathom is the one that we've researched extensively, but there's Otter. And we've used Zoom AI. Zoom's gotten even better. That's kind of where it first kind of introduced itself when we were using Zoom during COVID, because everybody would use Teams and whatever you use. But there's all these different engines. I remember the first time getting it was like not 70% accurate. But now the stuff has gotten so good. It's learning who you are, working through those things, and Fathom was the one that we elected as a company, and we'll talk a little bit about that. But our general counsel looked at that, how we should use it, how we should not use it, the PHI governance part of it, any business associate agreements that have to be used if you're going to use some stuff. We generally have a policy that if you're going to talk around PHI information, you can't use Fathom. But there are different areas. You know, we take a bit more conservative than others do.
Sure.
These are the different things as well. What other products are being used that might be helpful to some listeners as they're listening in?
You know, it's a choke point that we've always had. Look, a growing organization, rapidly growing, and there are constantly presentations that have to be created, right, constantly. And those end up going back to a director of marketing or someone on her team, or we have to outsource those pieces. And there's AI tools now, some of the ones we've explored, Beautiful AI, beautiful.ai, and literally you can take your presentation topics, your notes, your content, drop them in there in a matter of about 60 seconds. It actually can do a layout. Doesn't mean it's the perfect layout. It's not perfect, but it's got it organized in a manner that then you spend a half hour tweaking. And that whole presentation process before could have been an entire day that a team member spent laying out graphics, trying to get the spacing right, get the colors right, and instead designing the presentation topically using your content, and the slides would fall to it's a 60-second process, and then you just get to kind of steer it and make your revisions.
And I think the only thing that we pay attention to right now is because we want to stay original.
Yeah.
And sometimes those AI tools, they look like AI, or they're starting to be copycatted. Other people do something similar. So generally what we tell them when using this stuff is maybe for internal stuff, internal present, things that you might be working on that really doesn't worry about it. Now for me, for instance, I do a lot of webinars. I do a lot of presentations. So I want to be a bit more unique and original.
Yeah.
And sometimes the AI tools will lose that originality if you don't customize them correctly.
Yeah.
Even with all that we use. Most people use ChatGPT. Most people that are talking here, that's what they understand about OpenAI's ChatGPT. There's others that are trying to come around it with Elon Musk's Grok. Others that are working on it. Google's working on stuff around that. I think, unfortunately, for people that want to, it's like Google. Everybody says go Google it. They don't say Safari it. Or some of the other ones that are out there, I don't even remember, but there's another few out there. It's going to be the same thing with ChatGPT. Most people are like, go chat, it's ChatGPT. And even if you think that you're using Grok, you just inadvertently say that like Google.
It's like a Kleenex. Is it a Kleenex or a tissue? Yeah, we just say a Kleenex.
Yeah. That's the trademark of it and the brand. That's a good point. So most people use that, but the thing is you have to train it. It has to learn you. But remember, anything that you use in ChatGPT is open out there to so be very careful how you use it, what you put into it. So this is an area that we cautioned. Anything that you upload into it, a document, if it's already a part of the public domain, that might be a good way to summarize things. I need certain things. I remember using ChatGPT when the One Big Beautiful Bill came out. Mm-hmm. and it was a lot of pages. And I just decided I'm going to check and see. I'm going to upload the passage of the One Big Beautiful Bill, and I'm going to tell it to summarize for me in 2 pages the healthcare provisions. Now, I had already read through, I already kind of knew and understood it. It didn't summarize it right. And so I began to know when I started seeing things come to my mailbox or whatever, like they used ChatGPT because that is what they just said in their summary.
Right.
And so because you had to ask it very specific questions. So I spent about an hour just asking it very specific question. I want to see the exact excerpt, go here, do this, do that, cite me the exact, so then I could read it, compare it to it. And after a while, it started like, oops, you were right. I did fix that. I've now fixed and modified. And it will come back and talk to you like that.
Yeah.
Or I would say, you didn't do what I told you to do. And I would get real specific like that. And it's amazing how you just started to begin to tailor exactly what needed to happen through that process. And so tell us how you're using, because our 2 of our guys that have been researching a lot of this stuff or whatever, there was one thing that they're going to be demoing to our team, and it was around the calendar. And I loved how, because we do a lot of stuff in our service area where we have to look at how many hours need to be logged, things like that. And he demonstrated his calendar, and it brought back to him some of the inefficiencies in his calendar, how maybe that he could minimize here to there, and it was amazing. And so I'm like, okay, Susanna, who's my executive assistant, I want you to take my calendar, and I want you to see where I can gain some efficiencies or whatever. But it's a pretty amazing what it's doing. Okay. What are some other things that maybe would be helpful to people that are listening to on these AI? How can augment, how can help them?
As of late, had a vacation a couple months back, the rare occasions, and sitting there laying by a pool in California, I thought, I'm going to spend some time really getting to understand Grok, right? Elon Musk version of ChatGPT. And we happened to, as a family, were looking to do an auto purchase. And my 40-plus-year-old, I'm being gentle with that, my 40-plus-year-old mind would treat a search like I would go to google.com. I'm looking for this type of car and this zip code. And as I laid there, I spent more time actually asking more specific questions. I said, I'd like to compare this type of vehicle to this type of vehicle. What is the MSRP, obviously, but what's the resale value? How does it hold its value over time? What's the interest rates in the area should I be looking for? If I'm looking at a lease, what are some of the advantages over a purchase in my zip code, in my market? And the ability to push back information, consolidated, easy to read format, and then it gives you a chart at the bottom to do a side-by-side comparison, and then includes the links where then I can go and fact check it, which I love the ability to say. I could tell you another story of working my kiddos' homework. Kids are back in school. Some algebra comes home, and Dad's 50. I haven't done algebra in 40 years. And I looked at the problem, and I thought, well, let me just throw it in there. And I throw it into Grok, and it comes back with the wrong answer. And I thought, something's off here. And so then as I started trying to remember all these steps, about 3 steps in, I realized where it went wrong. And so I took a second and said, hey, you're wrong. This is why you were wrong. And it said, oh, okay, I've taken that under advisement. And then it corrected it and had the right answer at the bottom of it. So it's, and of course, for all the parents out there, I went back to our kiddos and said, look, you can use this to help teach you, but you're not going to use this to actually do the work for you. You can learn the steps and the process for it. So no hate mail, everybody, on that one. But it's interesting to go in and you can see it's not always going to be right, and you have to be able to fact check it sometimes.
And I think that's important what you're saying from the personal context. But let's steer it back to healthcare finance leaders and in their current way that they're using this. So, for instance, I think there's time and value that you can save. When we first implemented the note-taking side of things, even though it was only 90 to 95% accurate, the amount of savings and time that it saved our team was exponential. I remember Susanna telling me, I think I've saved about 20 hours a week of my time relative to now I don't have to show up on your calls anymore and take notes. I can look at the AI instrument, and it might be 95% correct. They're never 100%, but they get you enough window, and now you can replay the video if you open it up, and there are certain things that you'll need to get through legal side of it. Go listen to the podcast that I did with Alex Farr. She'll walk you through some of the best steps if you're looking at things like that. But there's a lot of different things. Another area is helping to create job descriptions, helping to create your policies and procedures. helping to craft certain emails and things like that. That's really important for your team because not everybody is grammatically correct. Depending upon the generation that you're hiring, we've learned too that sometimes people write the way that they talk. Right. And the way that they're talking on text or the way they're email. Sometimes I'll see like, I remember getting an email from somebody and they were talking about something. They said "your" and they put "you are," and I'm like thinking, you are kidding me. They just literally sent me an email writing how they might do something on X or on TikTok or Instagram. But this way it allows you to take that if you're not really good and don't know how to do that. There's different AI tools that can allow you to do it. Whereas ChatGPT, we use Grammarly. Yeah. A lot of people use Grammarly at oversights. It helps keep you in your, there's free versions, there's paid versions. Right. So some people are like, well, I can't afford to pay for it. Some of that stuff is free that you can utilize up to a certain component. And so I would say to people that might be listening that are just starting to dabble into it, allow yourself to kind of work. And start to explore several of there's so much of it out there. You could start researching today. Talk to another guy that he went to a Harvard program about AI, but they were talking about AI from a year ago because it's so evolving so quickly that it's just a lot of research, a lot of understanding and saying, I'm not going to be afraid of it. If you go at it from that perspective, you're going to get left behind. AI is here whether you like it or not.
Sure.
No matter what you think about AI, there's always going to be evil that's exploited in any of the technology tools. We saw it done with the Internet Explorer. It's going to be done with AI, but there's a lot of good.
Sure.
And I tend to focus on the good side of things and the glass being half full. Like, how can it help improve? And where are those things that I'm concerned about? I'm going to maybe put into phase 2. And we're going to do a lot of research. We're going to get legal involved as well through that process. So what other tools should we leave people if they're like just dipping their toe into it, crawl, walking, run, that they should begin to think and consider outside of a Fathom AI or looking at some AI tool to whatever? What are some other tools that healthcare leaders in the space of leading that can create more efficiencies within what they're currently doing?
Sure. When you talk about getting left behind, there was a survey that HMFA and FinThrive put together November of 24, so 9 months ago. And it said that 68% of healthcare organizations are already embracing AI into their RCM processes. And about 15% of those have seen a positive ROI at this point. And they made a prediction. They said about when they redo the survey at the end of this year, they said 30 to 40% will have already achieved the ROI from it. So we will absolutely, as an industry, be left behind. I think historically, you think back to the HITECH Act, it was 2009 when it came out. It saddled providers with a lot of administrative burden. A lot of folks feel like it was more beneficial for payers than it was the provider community.
Well, I don't know about that. I'm going to probably debate you a little bit on that. The HITECH Act gave millions of dollars of funding. Right. Unfortunately, it put some mandates on some providers that didn't get a part of that funding. Most of that funding went to the hospitals. And so while there is some issues around HITECH, and we always want to blame other people for that, we do have to understand where the money went and how did you spend the money. And so not to debate, I think it's always good to understand that piece of it, sure. But I do think HITECH has some really good processes of the intent of what it's to do. The problem is the money didn't follow the way the money should have followed, and it really focused more, rightly so, on the hospital industry. They are predominantly the largest consumers when it comes to healthcare and healthcare dollars. But unfortunately, some in the healthcare sector got left out of it, and so it became an administrative burden that was unfunded, or what we call an unfunded mandate.
Yeah, exactly. Well, and so following that line of thought, having multiple EHRs or EPCR systems out there, that's been a big obstacle in folks being able to now embrace AI, right? They've got legacy systems out there, and do we have the technology stack to be able to actually integrate AI? And so it's a real conversation, but we have to focus on the fact that it's here. You will get left behind. And with the cost pressures and the reimbursement being what it is, we're having to, as an industry, say, okay, we cannot be afraid of it. We're having to lean in, but there's nothing wrong with pick your entrance point, right? Look at manual friction points and start to address those and put the toe in the water.
And find those things where there's no downside. Right. That's what I'm saying. Start with that. If you're concerned about certain things like, I don't know what that's going to what that's going to reveal. But there is going to be transparency. AI is going to reveal and it can happen very quickly. And that was demonstrated in this administration under the auspices when Elon Musk came in with the Department of Government Efficiencies. A lot of what they were employing from the tech side of it was AI. Mm-hmm. That's why they were able to find so much stuff so quickly. Now, AI can reveal stuff, then there's context around it. And that is the piece, like where are the downsides, where's the context need to happen? And that's kind of what we're talking about, doing a crawl, walk, run. Where's there no downside? There's really no downside in taking and saying, I need policies and procedures around this. My policies and procedures haven't been updated for years. There's probably no downside with that. Yeah. It's probably a really great idea to go through and figure out, use AI tools to say, am I still practicing some of these policies and procedures that I say that I'm doing? Yeah. Have they been updated? These are where I'm starting to see people say, man, we're saving some time. We've been trying to do that. We've had to take people. We had departments doing that. Now it's like one person can do
part-time, do
the entire
and then
thing.
Focus on others,
Focus on other things. These are the type of things to start putting your feet into. As we kind of start winding down here, I want to kind of leave with a few things. One is, I've heard a lot of information around, okay, with the introduction of AI, where's critical thinking go? That is concerning. And there was an MIT study that came out. Yeah. The funny thing is, I saw the MIT study. The next week, I get an email from you, and I'm like, oh, my God, I forgot to forward that to you. But MIT, there's already starting, we're going to probably see more and more of these studies come out as AI, but they actually did a fantastic model of 3 different groups, where one did the traditional research, kind of going into books and researching. Like, think about the library concept with your library card, right. To understand how they would have that critical. And one used the internet tools available. Think like the Internet Explorer, Google, and kind of going through that piece of it. Maybe not so much going into the library and doing the research that way. And then one used AI. And they put them on EEGs to kind of see how their brain activities and receptors worked. And it hands down showed that those that use the AI tools lacked the same critical thinking abilities and skills that they saw in the EEGs relative to either, of course, the strongest was the one that used the traditional methods of research, and the other one, the second was those that use traditional tools like Google and things like that. That would kind of been maybe moving into our generation a little bit, the Gen X's, and then now you got the Wisey's and whatever else they call themselves are going to be moving into the AI. And so how do we protect our healthcare leaders, our finance type of it, to make sure that we don't lose that critical thinking ability? Because there's some things in healthcare finance you have to have the critical thinking ability about. There's things that can help you, like appeals letters. Like if you're writing an appeal to an insurance company as a healthcare provider, it can help you. But you have to have critical thinking to say, am I telling it what I need it to write for me? Or am I just letting it write it, thinking it came up with a great idea? And so you still have to tailor it. You still have to use critical thinking abilities and not to get away from that. And so that study, I think, is something that's at the forefront. And there's no real answer to it right now. But there are steps that we can put into place as business leaders, as entrepreneurs, as CEOs, as business leaders in our own divisions of our corporations that make sure we protect the critical thinking ability. What are some ideas, Brian, around that? I have ideas and thinking that we do that internally within our company as well. But from your perspective, how can business leaders who are afraid of that, are afraid of saying, I don't want a year from now, I have a lot of widget-minded or robotic-minded employees or robots doing things where I'm missing out on some type of revenue capture?
Sure. It's if I go to my local gym and there's a weightlifting machine that the robot lifts the weights for me, my muscles are not going to grow, right? They're going to get weaker. They're going to get softer. Even internally, we coach our team. If you're writing a critical piece of communication, it's a client, it's an internal something, don't just have AI write it for you. You write it. You put your thoughts into it and then run it through AI and clean it up, right? Make it more polished. Change your tone. A few weeks back, I remember feeling a little irritated about some things were challenges and just working through some pieces. And I thought, I feel like my tone and my email is a little bit sharp with my team. And so before I send it, I started running it back through, and I said, soften this tone for me. Make sure I'm clearly conveying I care, right? I want the best for you. I want us to keep growing together as a team, and make sure it doesn't sound too snippy. And how many times have leaders sent out communications that actually trying to coach people up and end up demotivating them, right? And so a great tool for that. But the critical thinking is to me write the email, me communicate what I'm really trying to sincerely convey, and then polish it with an AI. Great way of keeping your mind engaged in the process. A million times I've had AI write an email for me. I'll scan it and say, yeah, sounds good. But you miss something, right? Because you're not actually really processing what's being communicated.
Well, and I think, too, people lose the originality of who they are. And I think that's the problem that I see a lot. And I see that all the time because I can spot it a mile. I'm like, that's not how you talk. That's not even how you think. You're trying to come off and produce a persona that's not who you are. So I'm really big on coaching people up in our team, coaching up and having very clear conversations. I have no problem. Most people know me. I have no problem being very clear, very kind through the process. My sister always has to remind me that truth without kindness is brutality. And so I generally work on that because we have to speak kindly to it. But it needs to understand your tone and tenor, who you are. Or people will start seeing it as insincere. And you're already starting to see that now. You're already starting to see, was that developed by AI? And now you can actually throw it into tools that will tell you that was 87% generated by AI. And that tells me that no thought process went into that. You were lazy. You wanted to write something. I need you to write a note to my employees that tell them that we will not tolerate tardiness over 10 minutes. And then it spits something out for you. Well, that's not you. You didn't write that. You may have given it the idea, but you should actually write it and then say, clean it up.
Yeah.
Keep to my style and form, and it will start to learn you over time, and it will then begin to write it for you in your tone, your style, how you write. So that keeps the authentic of who you are. You're not losing the critical thinking ability. And I think that's really important that if you're beginning to dabble into AI right now, is understand that. Start building it. Don't start putting in prompts. There are some people that I see all the time like saying, use these 7 prompts to put into ChatGPT to tell you what you want. I'm like thinking that is the dumbest advice ever, but people probably follow it. They get likes, they get money for all their likes that they get, and they're steering people to be thinking like robots. And so what happens is we start seeing it, and now we're second guessing it. I remember talking to Stephanie over the weekend, and we're like, and I'm thinking, I think that's AI generated. We saw a video because there's some fantastic, Google probably has the best platform right now that is relative to creating phenomenal video. But sometimes it's hard to even find out, is that really real what I'm seeing right now? You can still see glitches that will come, but it's becoming so, it's amazing what it is. And it's like, thank God for engines, because then you can tell it'll come back and give you kind of a score and say 97% this was AI. And I'm like thinking, I'm not forwarding that. Thank God. You kind of have a check, but
sure. This
is where critical thinking ability, but what happens fast forward 10 years from now?
Right.
So I'm going to just wind up as we wind up this podcast or whatever. I wanted to leave one thing with the audience. So if you could look into your crystal ball, Brian, around AI, and we're just kind of moving into, this was actually a good segue, and just to take a year, 18 months from now, where do you think we will be with AI?
Good question. Good question. The adoption rate is growing at a extremely fast, right? As an industry, if we don't embrace it, we know we will be left behind. We've got pressure points to say manual grinds, finding more staff. It's like if I'm trying to bring people into a billing office, I can find people that are willing to but not capable of, or people that are capable of but they're not willing to, and retaining employees and some of those pieces. If I have a work environment where I've deployed tools and given my employees, my billing staff, the best technologies to be the most efficient at their job, I think that is something that helps retain employees. I think that's something that builds a culture around support, builds a culture around an organization that says we will embrace, but we are not replacing. We're going to augment what we do and be part of that growing team, be part of that organization. But adoption rate, it's through the roof, right? We're 68% of today, according to that survey that I quoted. I think we'll be at 80%, 85% in 18 months.
So here's where I think, and we'll kind of close it out here. Here's where I think, if I was going to look in my crystal ball, where we're going to be with AI. I always say follow the money. So there's a lot of new money coming into the space, high tech, PE. There's a lot of money being thrown into the AI space. Everybody wants to do AI. And generally when that happens, you move pretty quickly. And there is going to be a lot, if I was going to say reset, in about a year from now, we're going to see, unfortunately, a lot of the negative sides that AI generated in the healthcare community. That is going to show waste and abuse. It's going to show us transparent. It's going to bring transparency, which is going to be some of the good stuff. But there is going to be this area where waste and abuse has gotten in because some people have they just jumped into the water. They didn't do crawl, walk, run. And providers like us or technology companies like us, we're slow and steady wins the race. And so we're going to be very methodical about it. Unfortunately, you're already seeing the writing on the wall. People are just moving in. Some people are saying they're doing artificial intelligence and they're not doing AI. It's more machine learning. It's more bot, but AI is the new brand buzzword that we have. So if I was going to look in I think we're going to have mass adoption. We're already seeing it. I think everybody says they're using AI some way or the other. But those companies that move and launch too quickly to try to get ahead of the curve, will probably face some ramifications down the road and be an example of why you probably should be very methodical, slow, and steady. So, Brian, thanks for joining. Thanks for joining the Leadership Lab again. It's always fun when we do this. You're going to see more and more of that. Thank you for staying engaged and joining us, whatever. Pop something in the comments if you've got some questions, if you've got some lessons that you've learning on the AI journey of your healthcare organization. Feel free to share it. We'd love to share that with you as well. Thank you for joining us.